I welcome you all to today's talk. And in our today's video, we want to be able to talk about some of the various causes of erectile dysfunction. I'm using the word some because what I want to give you actually represents those very common causes of erectile dysfunction. There are other more causes, but because they are very rare, we shall not be able to then talk about them today. And therefore, I want us to get straight to it. And the causes of erectile dysfunction are broadly classified into two major classes. The first class is called the physical causes of erectile dysfunction. The second class is called the psychological causes of erectile dysfunction. So, having classified the causes broadly into two, let's have a look at each class one by one. Let's start with the physical causes of erectile dysfunction. The first physical cause are what we call the heart diseases, specifically heart failure. So when the heart has failed, then we realize that there is a weak force pumping blood to the rest of all parts of the body. And when that happens, then there is inadequate supply of blood to the penile region, leading to erectile dysfunction. The second cause, or the second physical cause of erectile dysfunction, is what we call the clogged blood vessels. And this can happen under a condition called atherosclerosis, or deposition of atheroma. Those are fats deposited in the blood vessels. And when that happens, there is inability of blood to flow freely to all parts of the body, and therefore resulting into erectile dysfunction. Fat deposited in the blood vessels compromises the flow of blood, particularly in this case to the penile region, and that contributes to erectile dysfunction. Our third physical cause is what we call the hypertension. So hypertension again emerges as another cause of erectile dysfunction. Our next cause is the diabetes mellitus, especially when it comes to the chronic complications of diabetes mellitus that we looked about in our previous clips when we were talking about the diabetes mellitus. So if you look at under the micro complication of diabetes mellitus, we have what we call the neuropathy. And neuropathy results into compromised the nerves that supply the penile region, leading to erectile dysfunction. The next cause of erectile dysfunction is obesity. Being obese puts one at a very high risk to develop erectile dysfunction. And therefore, we should keep watch of our weight. Anytime our BMI, or once BMI reads more than 25.9, then that points towards the danger signs or a danger sign. The next physical cause of erectile dysfunction is tobacco use. And this also predisposes one to other complications of the cardiovascular system, including the hardening of the blood vessels, what we call the arteriosclerosis. The next cause of erectile dysfunction is called various sleep disorders. Example, insomnia, that is lack of sleep, or even sleep apnea. The next physical cause of erectile dysfunction is what we call heavy alcohol intake. So those who do abuse alcohol also stand a very high risk or high chance of developing erectile dysfunction, and therefore be very cautious, and even if possible, refrain from heavy intake of alcohol. The next physical cause of erectile dysfunction is the injuries, particularly the injuries of the pelvic region or some of the major surgical procedures of the pelvic region, or injuries to the spinal cord or major procedures of the spinal cord. The next physical cause of erectile dysfunction are drugs. There are quite a number of classes of drugs that can cause erectile dysfunction, and they include, number one, various antihistamine drugs. For instance, we have cetirizine, we have cimetidine, and the list is long. We also have other antihypertensive drugs that can also cause erectile dysfunction. For example, the thiazides, the diuretics, for example, the loop diuretics. Those include things like Lasix, the hydrochlorothiazide, even nifedipine are just but a few of the antihypertensives that can cause erectile dysfunction. Other antidepressant drugs, for example, amitriptyline, and others can cause erectile dysfunction. The next cause that is also very common, and most of the people do assume, is what we call the prostate cancer. And prostate cancer is also on the rise, and therefore diagnosis always occur at a very later stage. And if one is not properly screened at a very early stage, one of the key complications that can occur to a patient with prostate cancer is called erectile dysfunction, plus many others. Now we are moving to the second major class of the causes of erectile dysfunction, and that is the psychological class, or the psychological causes. So which ones are they? Number one, we have depression. Depression is one of the leading psychological causes of erectile dysfunction. The next one is anxiety, and the last but not least is stress. When one is mentally disturbed and stressed, the possibility of gaining good erection is very low. And in such a case, one stands high chances of developing erectile dysfunction. Ladies and gentlemen, those are just but a few highlighted causes of erectile dysfunction. There are quite more, but the ones that we have talked about are the most common causes. If you are watching us for the very first time, kindly subscribe. And until next time, it's goodbye from all of us.